Hi, and welcome to Fairview Range Focus. I'm David Hall, Chief Administrative Officer for Fairview here in Hibbing. In this monthly program, we talk about health topics that are of interest to the community and to the patients that we serve. And today we're going to talk about occupational therapy. April is National Occupational Therapy Month, so a great month to talk about occupational therapy. So we're going to talk about and better understand how occupational therapy brings independence and function to patients that they serve. And I have the pleasure of welcoming two occupational therapists from Fairview Range, Nancy Hukka and DeAnn Zimmer, both occupational therapists. So welcome. Thanks for joining me today. So not everybody understands occupational therapy as well as you do. So can we start real basic and tell us a little bit about what is occupational therapy?
Okay, I'd be happy to. Thank you. Well, to start off with a little bit of a joke, oftentimes when I walk into a hospital patient's room, or I also work with home care, and I'll introduce myself, I'm an occupational therapist. I do work with a lot of geriatrics, and wait a minute, I'm retired.
Oh.
I don't want an occupation. I don't want a job.
Okay.
So oftentimes I start with introducing and explaining what I feel occupational therapy is. And so a big umbrella that I often use is occupational therapy is the skills for the job of living. So whether you want to get back on the golf course, go back out fishing, you need the hand dexterity to do so, the endurance to get down to the boat landing, those types of things. Our role is to build function and more independence.
Okay. And what about the education for an occupational therapist? How does one become an occupational therapist? I'm pretty sure you require some education for that.
Of course. It's now a master's program. We have 3 programs close to Hibbing. There's the University of Minnesota, the University of North Dakota, and St. Scholastica, and also St. Catherine's down the cities. I'm old enough that I have a bachelor's degree, but is now a master's program, and you can also become a doctor in occupational therapy.
Okay. And so did both of you go to the same program?
Nope, I went to the University of North Dakota.
North Dakota.
And I went to the College of St. Catherine's.
Okay, and that's in St. Paul?
Correct.
Okay.
And I should also add that every year we're required to do continuing education throughout the year, and we try to pick programs that are going to be beneficial to what we're doing on our job at Fairview and Hibbing. It's also part of our licensure. Every 2 years we have to renew our license to practice in the state of Minnesota, and it is required that we get so many units of continuing education above and beyond our formal training.
Okay, so pretty much ongoing learning and education. I think that's pretty true of most healthcare occupations, it seems like. So,
right.
Good, okay. And you work under the direction of someone, I believe. Is that, who would that be?
Our boss is Jerry Weiland, the manager of our clinic. Is that what you're asking?
I was thinking from the standpoint of the orders that are written. I mean, are you, do you?
Yes.
Yes.
We have to have a referral from a physician or like a certified nurse practitioner or a licensed practical nurse can all order occupational therapy. But we do have to go under the direction of a physician or one of the others that I mentioned.
Okay. Okay, so there's specific orders written by a physician. Do they sometimes keep it somewhat general in the sense that they want you to see a patient and kind of decide on your own, but based on your education and training?
Very often.
Okay.
Yep.
Yeah. You're correct. The initial referral might be to evaluate and treat.
Okay.
Once the evaluation has been performed, then we do tend to write a more specific treatment plan and have that signed. Okay.
So physicians clearly recognize your talents and skills in treating the patients as well. So,
correct.
Okay, great. How about the types of clients or patients that you see? Who do you see? What kind of patients do you see?
It's really a wide variety. As an outpatient therapist, my main focus is hand therapy and lymphedema treatment, but I also will treat people who have had head injuries, strokes, sometimes some cognitive issues. In the home setting, there's a lot of stroke recovery and general deconditioning.
Recovery from pneumonia, bronchitis. I've seen that a lot this past season.
Okay.
And then also inpatient care, we do everyone who's had a total hip replacement or a total knee replacement, we will work with people to help them regain their independence while still following precautions so that they don't re-injure themselves, but still be able to do things like put their own clothes on, get into the shower, get on and off the toilet, reach things that are perhaps down on the floor. So it's really quite a variety. And also we have a therapist who works up on our mental health unit, and she leads groups and does some individual treatment, helping people with learning coping skills, sometimes learning, how do you manage your daily life? How do you schedule things? How do you make sure the important things that need to be done actually get done? So.
Okay. So age-wise, it sounds like it really varies. It's not just geriatric or older people. Do you treat children as well?
We don't at our facility,
Okay.
but there certainly are pediatric occupational therapists who do specialize in that.
Okay. So mostly adults at Fairview Range.
Mostly adults.
Okay. And you mentioned stroke. Maybe what kinds of things might you do with somebody after they've had a stroke that you're helping to train them on? What kinds of things happen there?
Well, sometimes if they have an impairment on a limb, maybe it's teaching one-handed techniques. So maybe using adaptive equipment, learning how to butter a piece of toast with one hand, button a shirt with one hand, and just really regaining those skills.
Okay.
It might be just becoming more aware of one side, oftentimes what we call a left-sided neglect, trying to teach compensatory approaches to have that person turn and look before they just take their walker and start driving off to the one side. And so we teach techniques, possibly using some bright colored tape, scan to your left before you move or hit something, that type of approach.
Okay. So you've mentioned adaptive equipment.
Yes.
I see there's some things here.
On the table.
Maybe you could show us a little bit about that, because I know there's a lot of things available to help daily living activities and everything. So maybe you could show a couple of those things.
That'd be great. Thanks. Well, we'll start with one that's probably familiar to most people, and this is called a reacher. Some people refer to it as a grabber. So it's nice for getting those items that are out of reach. It just has a mechanism in which you squeeze the trigger, it clamps on the other end.
Okay.
There's many styles. Some have suction cups on them. Some are mounted horizontally, so you can reach to get a can of soup out of a cupboard. This one has a little bit of magnetic, so something like a pin or something's on the floor, you can maybe get that before you stub your toe on it. So not only can you reach objects out of reach, maybe, Nancy mentioned one of the clients that we work with are those who've had a hip replacement. So one of their precautions is to not bend or avoid bending past 90 degrees. So we can reteach somebody how to take a pant leg and bring that on over their leg and foot, so they avoid those bending types of activities. So that's the reacher.
Okay.
A couple other things that I brought today are in the dining realm. This, for example, is called a scoop plate. So maybe someone who doesn't have a lot of maybe just use of one hand. Sometimes I admit, sorry mom, I'm a little guilty of using my thumb to put things on my on my spoon. But this works great for having to slide and then having a ridge to push against.
I see.
And so it's the same concept
Okay.
with the divider plate. Divider plate works really nice too for those who have some vision. Maybe the meat is placed at 6 o'clock and you can tell them the meat is at 6 and the potatoes are at 10 o'clock, for example. And so it makes it easy for them to find those types of things.
Okay.
This is called a
Plate guard.
and so just on a stand, without having to buy something different, just using your plates that you have at home, you would put that on the side of your plate, and so it works the same as the divider or the scoop plate.
That's the proverbial sideboards I've always heard about. That you could put more food on your plate.
Oh, works
Probably
good
not
for potlucks.
Yes,
Absolutely.
exactly. Potlucks, that's it. Yes, I've always heard of them, never saw one. So there it is.
There it is. And then, of course, to show directly, this is a built-up handled spoon and one with the knife. And
Okay.
what I wanted to show here is just for an example on the cutting board. I don't know if the camera can see this, but in the case of low vision, when you have two different contrasts, you can see that the black handle shows up better than the white handle. So maybe somebody who's fearful of cutting something on a cutting board, using a colored cutting board for something like a white item Like if I put an onion or a potato on this one, it's not going to show up as well. But if I had a red or a black cutting board, that would show up much brighter. Or for the white one, if I'm doing an orange carrot, that'll show up a lot easier.
Right.
And so sometimes just your own dining scenario, you can contrast and help people see better. So those are just a few of the items that I brought today.
Okay. There must be lots of other adaptive piece of equipment as well. So I suppose, does it vary from one patient or client to another as far as what their specific needs are? And
Oh, certainly.
Okay.
Whether it's orthopedic concerns, whether they're having pain. You know, in the case of a knee surgery, maybe some people are having more pain than others and they're not having the mobility, so they need the reacher, whereas maybe the other knee patient doesn't need the reacher. Maybe in the case of a Parkinson's person, maybe they have times that they have more control, and others, they need more of a weighted spoon to help with some of those tremors.
Okay. And it seems like a lot of the things you're describing have a lot to do with independence.
Absolutely.
Helping individuals maintain or develop independence. Is that accurate?
That really is. I mean, that is our main goal, is to help people be, we call it functional independence, because there's not just one way to accomplish a task. And so if somebody can manage independently by using a piece of equipment or modifying the way they do it, I don't really care how they do it as long as they feel they are independent. And when we don't have to depend on people, it raises our self-esteem, it makes us feel a little more courageous to go out and try other things. And I hear that again and again. I don't want to be a burden on my family, or, you know, I've never had to ask anyone for help. Well, many of us don't want to have to ask people for help, and so we try to give people the skills to be able to do whatever the task is.
Oh, that's great.
It is. It's very satisfying.
Yeah, I bet it is. I bet it is. I know a little bit about some occupational standpoint having to do with careers and jobs, having to do with work conditioning, but I don't know anything more than that title. So is that something, I know, DeAnn, you're involved with that kind of work, are you not?
Yes, I am.
Maybe you can talk about that a little bit too.
Well, sometimes it all starts with the meat of having a descriptive job description.
Okay.
And for those clients specifically in work hardening or work conditioning, oftentimes I'm seeing them after they've completed their acute phase with physical therapy, and so their pain is more like centralized or it's more controlled and they're able to move on to the next step. And so I'll talk with that individual, what are your expectations, what are your job duties, do you have a functional job description, how much do you have to lift, carry, and then we'll design that program around that and talk about lifting mechanics for lifting, carrying, pushing, pulling, and just really putting that into play. We all know the saying, we're supposed to lift with our legs and not our back, but not everybody has that inner sense of where their body is in space, and they don't realize that they've developed awkward habits of twisting or hinging up through with their butt first instead of hoisting things up in a safe fashion.
Okay. Okay. And it sounds like, I think it's real helpful sometimes probably to have a third party, you being the third party, to be able to observe someone doing those things. As you said, sometimes you develop those habits, you don't realize you're using poor mechanics or, when you're lifting or something. So that's real helpful.
Exactly.
Okay, great. How about home health care? Oh, go ahead,
Oh,
Nancy.
I was just going to add, too, that the people who work at Fairview, we do a pre-employment screen, and DeAnn has gone through and looked at every job along with the managers so that they know, like she said, how much do you have to lift and carry and push and pull. And that's part of our reduction in injuries, is that when people come, they know what to expect, and we have checked to make sure that, yes, you can lift and you can push and you can pull. And that's really had a very positive impact on reducing the number of injuries on our employees.
Good.
I think that's great.
Yeah.
Yes, and I'm glad you brought that up. Thanks. Because, yes, there's the pre-employment screening process that helps, but then sometimes down the road, it also opens up for process improvement. So you're telling me that this is something you have to do for your job, but then getting that manager involved, does it really have to be done this way, or can we redesign how this is set up? A trash compactor is a good example. Pouring grease out of the kitchen is another example. Do we really have to use a big old vat, or can we take 2 smaller vats to drain that grease or that process?
Okay.
Yep.
And a lot of that work then really is related to reducing workplace injuries.
Absolutely.
Right? Okay. Which we know is it's an expensive thing, but it's also for the sake of the employees. It's not fun getting
Right.
injured and not being able to work either. So,
Because
Right.
it doesn't affect just their work, it affects every part of
Right,
their life.
right, great point.
And so, I always tell people, we want you here because we need you here, but we also want you to enjoy the rest of your life as well.
Right,
So,
right.
yeah.
Yeah.
And how about home health care? I think that was maybe touched on a little bit, but so occupational therapy is part of home health care too, is that right?
Yes.
Okay.
Yes, it is.
All right.
And basically with home health, I and other therapists are going literally to the home for those patients that are considered homebound. So whether it be from a mobility standpoint or an endurance standpoint, to have them come consistently several times in a week for an outpatient therapy, it's just too taxing for them, and it's just too fatiguing, or maybe there's too much pain. And so we offer the OT services and physical therapy services in the home. So I bring my bag of goodies, and we work on fine motor, we work on endurance, home modifications, suggestions of where safety rails could be, that type
Okay.
of activity.
Okay, good.
Organizing the kitchen, do we really need to have that on the second shelf? Can that be here? Can we change the hinge on this?
Okay. That sounds great. And what about referrals, or how does that work? I mean, if someone were watching this program today and say, gee, I'm really interested in that, and maybe that would be something they might benefit from, how would they go about seeing you as an occupational therapist? What has to happen?
They do have to have their physician's referrals. So
Okay.
going to their doctor and explaining what the situation to the doc, many times just through having a conversation with their doctor, and the doctor realizing that their independence is being affected by their illness or injury. The doctor can initiate the referral, the patient can request a referral, but then it does have to get sent down to our department, and we get them set up. We call them in and make an appointment. They come in for an initial evaluation, and together the client and the therapist work to set up an individual plan. Because one glove doesn't fit everybody. We have to make sure that their particular needs are being met through
Right.
the evaluation and setting up goals that way.
Okay. And how about insurance? Something we're all interested in is wondering, as far as if that's something that a service is covered by most insurances, or?
For the most part, yes.
Okay.
There are some caps with Medicare that we have to be careful that we're not using up all their therapy dollars. Some insurances require prior authorization before we do that, go forward with treatment. But we pretty much are aware of which insurances need that kind of thing. So when you come in for your evaluation, we follow through with getting the authorization beforehand. Also, if a client is not feeling comfortable with that, they certainly could call their own insurance policy holder and ask, is occupational therapy covered? For the most part, we usually are covered.
Okay, good. You mentioned home care and hospital environments. I'm just wondering, is there other environments where occupational therapist works besides the hospital and home care?
There's occupational therapists who work in schools. Their therapists will work sometimes even like preschool level. There are community health-based therapists who we don't have that here in Hibbing that I'm aware of, but in larger cities there might be like for alcoholics or drug addicts that are going to a community type setting, mental health settings out in the community. There's occupational therapists that work in prisons, other settings.
Clinics?
Clinic.
Well, sure. Here in Hibbing, there are clinics that have occupational therapists. With Fairview, my office is actually on the first floor of the hospital, but we are considered the provider for the Fairview Clinic as well, on the outpatient basis.
Okay. So lots of different opportunities in different kind of work environments to work in occupational therapy. So especially being National Occupational Therapy Month, is that an occupation that you would recommend to others? I think sometimes that happens. People watch the shows and they learn about different disciplines and fields within healthcare and say, gee, I wonder if that's something I would be interested in as a career, or my daughter or my son. Would you recommend it?
I
Yes,
would.
in short, yes.
And it's interesting because just last week my husband came home and he said, Do you know what occupations in the top 10 occupations in the United States? Occupational therapy is.
Interesting. Okay.
Yeah. I think it's a great career. It's very satisfying. Our work conditions are nice. I mean, I'm not working in loud or cold or that kind of thing. I mean, the hospital setting is a pretty nice setting to work in. It's good. You get to meet different people. You're doing something different all the time. Yeah.
Sounds very rewarding too.
It is.
I mean,
It is.
And I appreciate how we are taught in school to be an OT and how we see people literally as a whole person. They're not just the knee patient or the stroke patient. They are a mom, they are a sister. And so it's working within their roles themselves and finding purpose in their life.
Right.
So you're assessing that person from a mental standpoint, a leisure standpoint, you know, work, play.
Great. Good.
Yeah.
Well, thanks.
Yeah.
It's really interesting to learn more about occupational therapy, and thanks for both of you for joining me today.
Thanks for inviting us.
Yeah, very fun to learn about occupational therapy, and hopefully those watching today enjoyed hearing more about it as well. And so thank you again both for joining us, and that's our show for this month. So we encourage you, tune in next month for another interesting, hopefully, program on Fairview Range Focus. And if you'd like to learn more about Fairview Range and services we offer, our website is www.range.fairview.org. Thanks again for joining us, and watch for next month's show. Thanks.